Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Mika Newton. He's CEO at xCures, Marcos Domiciano, Senior Director, Healthcare Business Development at Clear, and Therasa Bell, co-founder and president at No2. Welcome.
Great to
Hey,
be here.
yeah,
Great to be here.
Yeah, I'm excited for this discussion. It's fun to kind of bring three companies together. We don't do this as often as we probably should. We should do it more often, but I love that you all have partnered together to create a great solution for patients that we're going to dive into today. But before we go there, Mika, why don't you start us off? Tell us about yourself and xCures.
Sure. Thank you, John. So my name is Mika Newton. I'm the CEO of xCures. xCures is a 7-year-old business. We are in the business of aggregating, organizing, and structuring electronic medical records and turning them into something useful for a variety of different applications.
Awesome. And Marcos, you want to go next? Tell us about yourself and Clear.
Sure. Hi, everyone. I'm Marcos Domiciano. I manage business development at Clear, really focused on bringing our secure identity platform to healthcare. Beyond the airport, which we're most known for, we work with healthcare organizations to power trusted patient and employee identity experiences. Excited to be part of this conversation.
Awesome. And Therasa, how about yourself and No2?
Yep, I'm Therasa Bell, president and co-founder of No2. We've been around for about 13 years and today serve as the largest communication network in healthcare, and happen to be privileged to be partners with both of my co-participants. So xCures is a partner of ours along with Clear. So excited to be here.
Awesome. Well, I appreciate you all being here. It's interesting, Mika. xCures recently announced a fully functional IAS, which is Individual Access Services solution. Why do you see this as such an important milestone that, you launched, this ability for patients to be able to access their health data?
Yeah, it's a great question, John. First of all, I've been excited about IAS for all 7 years of xCures existing. And it really comes from when I was thinking back to the inception of the company. We built the company to be able to help, at the time, advanced cancer patients, but we've always thought about all sorts of patients with complex and rare diseases, be able to access their own data, use that data to be able to help them make better decisions in healthcare, and then learn from that data. So overall, as a community, would be able to learn from information. And that's actually been a very difficult thing to do for most people. And we learn this from interactions with thousands of cancer patients. They walk around with banker's boxes full of paper medical records. That is not an unusual thing. And so for someone who's in that situation, to be able to have electronic access to their medical history to empower them in that journey makes a huge difference. And I also think it's the difference between digital health not being a thing and digital health actually being a thing. And we are right at the cusp of that resolution now. And so we wanted to make sure that people knew it's here, it's ready, right? It's time to be able to move this whole thing forward.
That's awesome. I mean, boxes and binders, the pain of every patient, it feels like. What's interesting for me at Healthcare IT Today is I've been pitched probably 500 companies that all see the problem, that we don't have access to our data in a digital format. And then also, okay, let's imagine we do have access to all that digital data. What do we do with it? And you highlighted kind of both of those areas to some degree. And Therasa, I'd love to hear, you're the QHIN that's kind of supporting this effort and giving access. We know, individual access for patients is such an important part of TEFCA and QHINs. What records are now available to patients, through this effort and, even outside of the QHIN effort? And what does it mean for them?
It's a great question, John. I'm actually going to go backwards to go forwards on your question,
Sure.
if that's okay. Want to touch on something that Mika said, because I also have, we've pushed hard as a company for a long time in our care quality efforts and in our TEFCA efforts to see consumers have access to their records. But at the same time, I've been the biggest pessimist on it. And that had to do with before AI and before companies like xCures. I knew that the patient, we had this feeling as an industry that if the patient just had access to their records, I can download an app, I can get all my records on my phone, that it would create this revolution in our healthcare. Like we'd see patients get so much healthier. And that is false. I mean, like 10%, less than 10% of patients actually manage their finances, or humans manage their finances. to think that they could take then the complex data of healthcare and manage their healthcare without assistance was a narrative that was never going to live. But now with groups like xCures that are taking the data and making it meaningful and making it actionable for a consumer, such as myself, right? A consumer that I can do something with it and know to take action on it. That is the magic bullet. Because without it, it was just accessing data for data purposes as really hard data for that reason. But back to your question. So what data is available? So we were super excited when finally the individual access services, we got through all the governance, we got through all the difficult components sitting at the national level, right? A lot of considerations that had to be taken place, but we got there, right? And we got there kind of in full agreement with other QHINs, but participants on those QHINs also saying, yeah, we're ready to do this and we're ready to start making it available. So with that, it wasn't just, okay, now we have this operating procedure, this SOP that drops from TEFCA and it worked. It wasn't that actually. It took about 6 months to get through with partners like xCures to get through all the nuances because there was variability in the systems that were responding that we had to work through kind of collectively, in addition to bringing in an IAS provider that was trusted, right? So there was a lot more to it than just the SOP dropping. So finally, we saw success here. For us, it was around the March timeframe in 2025, where we were able to get to every endpoint and say anybody that was participating in IAS, and I'll get to that, your long-winded answer to your question here, John. Anybody that was participating, we were getting responses back. And it wasn't, again, it just didn't work out of the box like we had all hoped it did, but we're there. So what's available today? And I won't touch on what's not available, but what's available is for anybody that's participating, any participant that's participating in TEFCA today. So Epic Health Systems that are participating, for instance, Athena, ECW providers that are participating, the same requirements that they have for responding to treatment queries, they have responding to individual access queries. So when they come through, they have to respond with the same content and provide that back. Now, there is a little bit of nuance, as everybody knows, with how Epic responds, but again, we've successfully navigated that with partners like xCures. So those that are participating in TEFCA as participants that are responding systems are sitting there. So what does that equal today? Probably not much higher than single, like 12%, 15% maybe of healthcare records are available today. That's quickly changing month over month as we see more and more people jumping on TEFCA. Outside of that, then you get to outside of TEFCA, where you don't have a trust framework, navigating connectivity, then you're getting down back to what we've experienced, where you have to have the patient's logins to their individual portals. And there's systems that are broadly supporting, with a lot of complexity, broadly supporting access to records that way to, I'd say, the certified EHR, and it's the major certified EHRs. But that will quickly dissolve and move into the trust framework because it's just too difficult to maintain and navigate for a patient. But today, let's say it's 15% of records, quickly to probably by the end of the year again, I'll talk to the whole portion of the record. You have access to about 15% of acute care stays, ambulatory stays that are in the record today, quickly to change by the end of the year. We should see close to 50%, 50 to 60%.
Yeah.
I'm going to pile on a little bit here because I want to make a great point Theresa made about how all of this took some time to come together. Like there was the concept and then there was a lot of work. And I think between K02, xCures, and Clear, what we put together is actually the solution that people need in order to go and do the useful things, right? Because what's important here isn't just, can you exchange data?
That's right.
It's, what are you going to do with it? Because we don't do anything with it. I mean, honestly, who cares, right?
Didn't Judy from Epic famously say, what are the patients going to do with that data? She's come around, I think.
In a world of an abundance of AI, right? And of application,
Right.
all of things that suddenly exists. And the issue that entire universe has is it doesn't have an integration point. And so between the three organizations, the way that I kind of think about it is we have at No2, the internet of medical records. Theresa talks about being the network. Like it's like there's this enormous network of interconnected participants. More and more participants are joining that. That network is getting stronger and stronger. So now if you want to enable a person, right, to get on there, you have this obligation for identity verification, which is a whole lot of sense, which is how do I know when random Joe, John Doe walks in who he really is? And Clear has been not only a leader in that technology. I have my own personal legend here in my own side that I think I've been working with Clear since 9/11. I think it was different organizations on the way, but a huge kind of experience in identity validation verification, but now also brand recognition. Like think about being a regular person again and like, who is this company who's making me take a picture of my license and fake selfie and all the rest? Like having the brand, I think that Clear does in that space is none. And then at xCures, we're stitching those things together, right? And then presenting the data now to anyone who wants to implement it in a way that's compute ready. So first of all, an ability for patients to go and see it, but then a secondary level, which is how do you take your data and actually give it to someone to help you go even further? And you can't just take the raw record, right, in the way that they are. You need to turn them into this compute ready format. So it's ready to power this kind of next generation of healthcare. And I think as we see participation go up from the providers, we're also going to see kind of this wave of, I think of it as digital health that's kind of been stymied in many ways, limited to basically stuff you can type in, come into existence. And I'm really excited about that revolution, which will be a whole ecosystem in and of itself.
Interesting. I mean, you highlight a really important point, which is the identity piece of this. How do you trust that that actually is my data? Especially John Lynn. I mean, how generic is that of a name, right? Like there's a lot of John Lynns out there. So Marcos, I'd love to, loop you in. We have all this data, but identity really is the key. Talk about Clear's role in making this solution a reality and kind of helping to solve that identity management so we actually trust that the data is ours and not some other John Lynn out there.
Yeah, no, absolutely. I mean, we think about interoperability in healthcare starting with identity, right? You need to know who that person is. It's a trust component. It's also being able to properly give that person access. I mean, we started in airports, as we mentioned, but similar to healthcare, identity is the foundation of these trusted experiences. So right now, we've all experienced it. Identity is fragmented. Patients have to prove who they are over and over again. Providers and payers don't have a way of authenticating people that's consistent. And the result there is really just slower care, higher costs, and more security risks as well. So as more and more care moves into digital first models, even though it's taking a while, it's really getting there. Having that trusted, reusable identity, we think of it as no longer being an option, but actually being something that's essential, and for both clinical and operational reasons as well. And so that's where Clear steps in, right? We can be the trusted identity platform that can unlock interoperability across platforms and organizations, right? We have reusable identity. If you verify at the airport, you can use it at your health system. You can use it with xCures. You can use it at different organizations. And we're seeing really strong adoption. We're seeing higher success rates in the traditional ways that folks are doing it. But ultimately, we have the ability to provide IL2, AL2 verifications, which is critical for being able to unlock this information. So, being able to verify and authenticate people in a way that's trusted and seamless is important to us for patients and providers. So we really see that being a big part of the void that we're fitting.
Yeah. I mean, as Mika said, you have brand recognition. It seems like almost every American has probably heard of you. I was even thinking about this in the context. Epic announced that I think 52 or 54% of people had a Epic MyChart, which I would have thought it would be much larger, right? That means 40 something percent don't have an Epic MyChart, so they don't know the identity of an individual patient. I mean, imagine you face that, Marcos, with, some of the people, and I'd also love to hear, one, how distributed are you into, the having the identity of a patient, and then also talk about how it aligns with CMS's efforts around identity management. I think a number of you, I think Therasa was there as well, the whole interoperability efforts that CMS is doing around identity management. I know Clear was mentioned there. How does this align, or is that different from this effort?
Oh yeah, no, it's definitely aligned. And just going back to the first question, we've got about 33 million members across the network, and they may have gone through the airport and signed up. They may have gone to Home Depot to rent equipment. They may have verified their identity on LinkedIn. They may have gone to one of the health systems that we power. I mean, there's a whole world of places that we exist. And again, that's great because one, it builds the trust. People know who we are. I feel comfortable doing this, government ID, selfie, workflow with this organization that I know that's connected to the airport and so on. But it's also helping us build that baseline of members. So a lot of those folks may have already verified with Clear. As far as CMS efforts and the work that they're doing, we're directly aligned there because our identity, we look at identity management delivering what CMS has long called for. So it's a trusted, reusable digital identity reduces redundancy, improves interoperability across healthcare. So if we can give patients and providers a single identity that works across systems, we're addressing one of their biggest pain points, right? And they've highlighted that fragmented identity practices slow down care, as we know, it drives up costs, creates security risks. So how do we bundle all that? We want to be a part of that, especially since we can work across platforms, right? At the same time, right, we're meeting the technical and policy bar that they've set through adherence to the standards like IL2, AL2, right? So we're meeting those, ensuring high confidence verification, authentication, and so forth. And so our approach advances, we think, CMS's vision for, a secure patient-centered access to health information, right? Making it easier, making it more efficient. And so we're proud to be a part of that.
Yeah. Therasa, I'd love to hear any thoughts you have on identity management. You're working across all the systems. That's interesting. But also, let's get to the point that you said, hey, let's not talk about who's not there yet. But I'd love to hear, what other data do you wish was available on the QHIN or even through other methods? What's missing? And that becomes more of an identity management problem too. I mean, so it's kind of in the same vein, but I'd love to hear your thoughts on what's missing from the QHIN and then any thoughts about identity management.
I'll take them in that order. And yeah, thanks for, I have a lot of thoughts on the identity management, and the CMS initiative is driving clarity that's needed, because there's some complexity to identity management that sits on the matching side, right? That aren't always attributed to identity management, but it's absolutely part of it. But to answer your question of what's not there, it's a funny misnomer, and I'll name drop here, but often people think that if I get access to Epic records, I must have access to the entire patient record. That must be it, right? There's this thought that if I have access to Epic, it's the end all be all, and it's great, no doubt about that.
I have a lot of records.
they have a lot of portions of records, right? And so most often they're attributed to acute care stays, and they're attributed to my physician if I have a PCP, or maybe I have a specialist that's in Epic. But the word healthcare and the word provider is so wide, and people forget that most healthcare is actually delivered outside of a health system that people seek on a daily basis. And that's what's not there today. So when we talk about the longitudinal record of a patient, it's not if I have access to Epic, I have access to everything. Is I have access to portions of my record, right? So to your point on 48% of whatever you said it was, that's 48% of portions of every patient's record. And then we have the vast majority of the rest of the record, whether it's if I'm a Medicare patient, I don't have my SNF, I don't have my home health, I don't have my PT, I don't have my independent provider that's not using a major certified EHR. So you're looking at, our estimates are between about 60 to 70% of every patient's record are not accessible today. And that is what we're absolutely focused to as a QHIN. So when, Mika talks about that, we're kind of democratizing healthcare connectivity and healthcare access to data. That is absolutely what we take very seriously, is bringing on, there's about 2,000 EHRs or types of EHRs in the market. Only 200 are certified, right? And so when we talk about that, it's what clinical data is available. What do we have to bring on? So when we bring on an EHR vendor that's never had to meet meaningful use, that's never had to be certified, that's never had to meet any requirements for FHIR, for US CDI, anything, and we're bringing them on, and we're asking them, by the way, with the CMS aligned networks, to be live by the end of the year with whatever data they have. The only reason we can do that, and I'll point back to it, is because of AI. Is because AI is flattening the need for things like semantic interoperability and all of this. It's flattening all of that. So a massive portion of the patient's record is not available today. It will be. We are committed to about 150,000 provider organizations over the next 12 months that will be brought live through No2's QHIN. By contract, they have to be brought live. We're hoping to close that gap on the record to roughly leaving about 20% by our estimates. That's still not attainable yet, but it is our number one targeted focus, is to get the access to the individual records, and for providers, by the way, those are synonymous to us. Get access to the provider, get access to the individual, and we're doing our job as a network and a healthcare network. Related to identity, it's very interesting because we definitely we're in full support. Obviously, we have a very special relationship with Clear, which we're actually expanding actively as we speak with Clear, because of the CMS initiative, where they call out identity both for patients and providers, right? So we're working with CMS to say, hey, what's a provider? Because you probably think about it as a doctor that prescribes. Well, they're likely already identity verified because they prescribe controlled substances. But what happens when I get a PT on there? What happens when I get a nurse? Are we asking for all of them to be identity verified? So we actively looked at that and said, we're going to expand our relationship with Clear right now to get to identity verification for the entire audience. To patient's identity or consumer's identity, the identity verification upfront, critical, absolutely critical and required, right? Then you get to matching on the back end. So today when a treatment request goes through the networks, there's what I would call probabilistic matching on the other side, right? So an Epic receives for a treatment, but they're covered by HIPAA. That's their safety net. So if by accident I do a request for Traceabelle's records and this Epic system responds with some other Traceabelle, by the way, there's only 2 in the US as far as I know, it responds with another Traceabelle's record, it's covered by HIPAA, right? So there's not a breach that occurs there. That is not true of individual access. So if a match occurs or a mismatch occurs where that they say, oops, I think I have it, but I respond with somebody else's records, then you have a breach, right? So it's not covered the same way. So there's a lot of consideration. So with CMS coming in and actually putting impetus on the EHRs to confirm the patient's identity, actually start collecting identity as part of the patient's record, so I can do that match when the inbound request comes in. That's the missing piece that doesn't sit there today. I don't have that identity like that Clear or any CMS approved identity provider. I don't hold that in the EHR today. So it's back to my matching algorithms, and EHRs, the way they've matched today for IAS is it's 100% confident or nothing. And that is not true for treatment. And so there's a lot of consideration of how EHRs bring this back through their workflows and start to collect the identity of patients so they can do that match and not be subject to their matching algorithms that sit in the EHR today. I'm excited for it. It's a lot of work. I think it's a lot more than people understand, but excited for it because it will unleash healthcare with getting it covered. Sorry, that was long-winded too.
I want to.
No, I love it.
Just a
Go ahead,
confirmation here. This is, I think, really interesting. We just did a study of our own data looking at what comes back depending on how broadly you look across the health spectrum. You're talking about the percentage of patients come back, and our numbers match exactly what Theresa said here, which is we see approximately 200% or that 30 to 70% differential from what you would get from, let's say, the typical Epic Care Everywhere type query. And then all the other stuff, when you start looking broadly around it, we've done a lot of work around how to optimize, right? How to find, you have to find the data on these networks. And what you're talking about security really eliminates that having to find. It's actually a thing. We've built a whole process around it of just how do we actually find everything? And that would all be much, much simpler if there was identity verification on a system-wide basis. It would just eliminate it.
Yeah.
Get rid of the
And assuming
fax
it's live, right?
right?
Assuming those, sorry, Marcos, go ahead.
I was just saying we can get rid of the fax machines, which is still a way for someone to share their data. You know, when you go to a doctor, you've got to get a fax. Well, they're going to fax it over here. I mean, it's crazy. So it's exciting.
Well, they need to be no two connected, right? But I
Right,
mean, what's
John.
interesting is you could do it, you know, fax machines still are one of the most interoperable
Works.
parts, as long as it's a digital fax that then, to Theresa's point, uses AI to turn it into valuable data. It's not awful. You know, it's what, you know, paper faxes should be dead for sure.
Yeah, the CMR records, John, are 30% embedded PDF, TIFF, JPEG. Like we've measured that part. So if you're not up processing like a full OCR NLP stack, imagine you're getting all this information in those images, and that information is non-compute ready stuff. I often ask myself, like, how do we even treat the patients? And so we've done a lot of work on the treatment side. I think the point here is coming to IAS. It's like ready to start going. So all these capabilities that are being kind of emerging and evolving are going to be available to individuals and to the organizations that now are going to support them in much more of a consumer-facing way. And I think that that's been a big kind of trend in healthcare, is moving more towards consumer-driven healthcare. I think it's important from a lot of outcomes and cost perspectives, but it's been almost impossible to do. It just didn't work. And I feel like it's finally going to work, and we're going to be able to do that.
Well, let's talk about that, Mika. I mean, as we kind of wrap up here, like I framed it as, hey, first you need to identify who the patient is, then you need to get them their data, and then you need to do something useful, which Theresa commented about as well, right? Like, it's great, you gather all the data, but how do you make it useful? Like, what do you see as the value for patients that they're going to receive out of this IaaS solution that you've put together. To Theresa's point, we don't have all the data yet. We're making progress. Can you provide value to the patients, even with the data that we have today?
So I think the simple answer is yes, and many of these applications already exist. So if you start looking at the applications, particularly in the AI, and I would think of clinical decision support or decision support space, that have traditionally been connected directly into the EMR, right, or through some affiliation with a particular provider system, and might have some digital app component to it. Something might be managing your heart failure. We see a lot of women's health applications. We see a lot of things in helping people manage health and wellness and fitness, right, where we're all learning that whole health and wellness thing and healthcare are actually part of the same continuum. If you can bring those things together, right, and then make them much more interactive, you get away from people. One of the barriers there is you got to type everything in. Like, you're literally entering all the information about yourself into every single app you want to use over and over again. And in this world, you'll be able to connect those apps and disconnect them, right? If you don't want to use them anymore, turn them off, switch them off, manage your healthcare data in the same way you would manage banking data. We were talking about that a little bit earlier. So that's really exciting. I'll give you another thing that I think is going to have a huge impact, and we've been working on this. We have our first implementation of it going out, which is understanding, are you getting the healthcare that you should be getting, right? So if you think about measures, so think of quality measures like HEDIS or HCC risk adjustment. This is all like payer sort of stuff, right, in general, but it exists for a real reason, which is like, if I have hypertension, is my blood pressure actually managed correctly, right? Has somebody missed something? Should I be on different medications, right? That has a material impact, right, on how long I'm going to live and what my quality of life is going to be. It's that basic. And so being able to, in real time, manage my health status in a proactive way that has all of this logic sitting on top of it, to the point that was made earlier, which is like, how would you do that yourself? You'd have to know all those things. But that world is coming where you know kind of where you stack up, what's missing, right, where it is that you could make improvements, and that can go across both your kind of personal wellness life and your actual healthcare interaction.
Interesting. Well, I think we could talk for hours about this. It's a problem. Like I said, hundreds of companies have seen the problem, but accessing the data in a way that's trusted and being able to then use that data to do good has been a challenge, I think, for many organizations. So I love to see the progress, and happy to see that it's working on standards that are being used other places like Clear and like the QHINs and TEFCA. So appreciate you all taking time to share about this nice collaboration between all three companies and organizations. I appreciate so much your time, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks so much.
Thank you, John.
Thank you, John.